Health statistics show that an estimated 7 out of 10 patients die due to medical emergency conditions, signaling the need for the country to strengthen the ambulance system. Ministry of Health has already realized this need and is now working with developmental partners like Maltese International to address the gaps in the emergency health care system.
The most important thing is for us to move. We may not move at the pace that we want, but ladies and gentlemen, we are here to move. We have no choice, we must move. And we must move in systematic way to build emergency medical services, not just in visibility, launches and what, no. To create an impact in emergency services, that we are able to save lives, that we are able to improve that. First of all, first responder, it is not there. We used not to be there completely. Now it is there. Thank you very much, the partners and everyone who has been training. I know that we have been training multiple teams in first responding.
Under the rescue chain, we talk about first aid. And when we talk about first aid, we have already started the curriculum for the first aid, which is under the review, still with the Ministry of Health. Along the rescue chain, there is development of professional emergency care. And ladies and gentlemen, I would like to inform you that recently, we've just launched a curriculum for the emergency care assistants, which Ministry of Health has been the lead in this.
The Ministry of Health has now received a boost in terms of uniforms for emergency caregivers, courtesy of Maltese International. With this branding, emergency caregivers are advised to be mindful of how they render emergency care services to the public.
And in this daily struggle, uniforms matter. EMTs need to present a very clean and professional look when they are on duty, because people they care for and their relatives, they need to know that they know what they are doing as EMS professionals. And here a lot of studies have shown that uniforms actively participate in the required changes of perception by the public to recognize, respect and support EMT's work.
And we also want to appreciate Maltese International. It has provided some resources which are going to add on this uniform. Again, we thank you for that decision, Maltese International. We shall have all the teams uniformed.
An emergency medical system is defined as one that provides care to patients in the pre-hospital or out of hospital and caters for other serious time-sensitive illnesses.
The interventions provided by emergency care teams, whether in hospital or in pre-hospital environment, make a difference between life and death. If we had time, I would have to tell you stories how you came and picked off my mother and father during a very critical time. That's for another day, but we thank you. Emergency care provides non-critical care to very ill patients along the continuum of care from the community, along the roads, during mass gatherings, during disaster. Therefore, being visible is important.
However, lack of trained emergency health practitioners and uncoordinated ambulance system that hinders prompt emergency response remain a challenge. Adiana Kote, UBC.
And I want to